Hi everyone. Thank you so much for joining me today. I'm really looking forward to diving into your topic. So I'm actually going to give you the floor, ask you all to introduce yourselves, and we'll take it from there.
Great. Hi, I'm Jane Kosloff. I'm a therapist in the greater Seattle area, and I'm also an MDRIA approved consultant in training.
Hi, I'm Skylar Ibarra. We should have gone over who's going to introduce first. I'm Skylar Ibarra, LCSW PMHC. I'm an MDRIA approved consultant in training as well.
And I'm Erin Wheeler, and I'm a therapist in Chicago, Illinois, and also CIT as well.
All righty. So I think we're going to start a slideshow because who doesn't like a good slideshow? There we go.
Yeah. So we're going to start this slideshow with a little bit of information. And the reason, just a background for part of why we wanted to even do this presentation was that I think you all, like us, have noticed that, and it's felt like, that maybe there's been an increase of perinatal folks who are coming into your office and either already identifying as ADHD or wondering about whether or not they have an ADHD profile, struggling with some of the things that are involved with executive functioning and wondering about that. And we really wanted to examine the question, like, is this actually happening? We feel it, and we obviously are examples, and we'll talk a little bit more about that later, of how we've been both the therapist and we've been the client in navigating that perinatally. But we wanted to know if the research backs that up. And so, or the question that we sort of started with is this true that the rates of ADHD identification are actually sort of rising and growing in the perinatal period? And the answer is yes, that is a fact. So your instincts are not off. Through the research we did of recent studies, luckily people are looking at this question. And the recent studies that we found do show that there is an increase in diagnosis for ADHD for cis women, cis folks who are assigned female at birth and who identify as female, as women, and that are in their reproductive years, so in that perinatal period. One of the studies that we found that was most recent and most comprehensive was a study called "The Number of ADHD Patients Are Rising, Especially Among Women." And it's hard to see this graph in our PowerPoint, but I will say that one of the really interesting findings was that the incidence of ADHD diagnosis in this group of 23-year-olds to 29-year-olds, and then 30-year-olds to 49-year-olds in the cis female population had nearly doubled from 2020 to 2022. So that later group, so those two age groups that are later, which encompass what we consider the reproductive years, the ones who would be considered, potentially are, going into this perinatal period that we work with, that group is vastly growing in the number who are self-identifying or engaging in diagnosis, in this case, for ADHD. And so it really backs up also the idea and the other research that we found that as diagnoses are growing for cis women, that identification, that diagnosis is happening later in life. So the growth and there's an expansion of that for the cis female population later in life. So we know that this is true. We know this is happening. Your instincts are correct. And with that, I think one of the things that we've noticed is that then we come to that reality, that fact, with some of the questions, curiosity, confusion, concern in terms of what does this mean? Why is this happening? So there's questions of, is this overdiagnosis? Is this misdiagnosis? Or is this something else? So in trying to answer this question, and this is such a broad question that we're just sort of giving you the beginnings of our research and our overview and what we've learned. But some of the main factors that we're learning are factors that are influencing that rise of perinatal specific ADHD identification. And again, we're really focusing right now on cis women who identify with the being assigned at female as female or woman. This is the group that we're looking at. But some of the factors that we found that the research backs up as contributing to that rise is the broadening conceptualization of the ADHD profile. So if you look at like many other disorders, but especially with ADHD, I always say it's sort of the male and pale, right? Like this is a both researched and conceptualized disorder model that focuses on white boys, and it has. And it's only recently that with a lot of pressure from society and from the neurodiversity-affirming movement to say like we have to understand that this is not going to look always like that. So the introduction of understanding inattentive type, that characteristics and traits of ADHD can be expressed not as bouncing off the walls and causing trouble in class and, actively, not paying attention, that this can be a more subtle presentation of inattention in terms of forgetting, keys and, daydreaming and just, these factors. And that there are these gender specific differences that can come to play in terms of socialization, levels of masking. So that is starting to broaden, and that has allowed what we call the lost generation of women and that's primarily millennial women, to have their expressions of ADHD and what actually fits with their lived experience seen in the actual growing conceptualization of it. And so they're getting these diagnoses and being able to finally get the validation that this has been going on all along. And these millennial people are starting to hit the perinatal period. And so we're going to go back to the previous one, Skylar, because I just want to finish up so the other thing that is a factor that's adding to that rise of identification is just the increase in awareness. So there's a lot of concern and questions and feelings about social media and TikTok. But the fact of the matter is these are spaces that are actually getting information out to people and communities that normally haven't been seen in that male and pale conceptualization, to be able to start to talk about the ways that it's different in different communities, different genders, different lived experiences, and to be able to identify into that and to be able to have that validation that the medical community hasn't always been able to do. And then that's put pressure on the medical community to start to change and build their awareness of how ADHD can look different in different age groups, different populations, and to broaden that conceptualization. And then the last thing, in terms of the rise of that perinatal identification, is that, we are also not only experiencing a lost generation of the cis female population in general, but we also have the factor of that this is, we are seeing white women getting these diagnoses, but I mean, even more so, we have had an incredible underdiagnosis and misdiagnosis of cis women in marginalized groups. And so, and there's a lot of factors that go into that. This is not my lived experience. And but I will say that some of the research that I've done and trying to listen and learn, there's a number of factors that go into that in terms of, the medical racism that goes on that leads to misdiagnosis or underdiagnosis. There's the lack of community information about the ways in which this broadening conceptualization has changed, which is an aspect of white supremacy. There is the impact of marginalization stress that says, you have to just kind of keep going and be strong and not, don't look back, just keep going. And so there's a number of these factors that are happening. And with that being said, things are changing. And so we are going to see that not only are there more women in this perinatal period in general, but my hope is that we're actually going to see more women of color who are going to be able to be supported and validated in coming into the fullness of their ADHD identity. And so I want to really reframe and conceptualize that the idea that there's a rise in this identification is actually something that we can embrace. Because it's a reflection of a society that's demanding for people to actually be seen outside of this supremacist medical model, this male and pale model. So in that context, I'll give it over to Skylar.
So with that, we see that there are some common challenges with ADHD parenting. And a lot of times when we are ADHD unrecognized going through life, we get kind of these hacks. We're able to figure it out. Maybe it's stressful and anxiety producing. We identify as just being high anxiety all the time or a little forgetful. But then all of a sudden, pregnancy hits. Pregnancy hormones hit. Pregnancy demands hit, and what we used to have the bandwidth for, we don't anymore. And so we see that we've conceptualized that there's really these 4 factors that highlight the ADHD experience that within the perinatal period, which is the demands on executive functioning, right? All of a sudden having to do one routine, and now you have 2 people's routines, 4 people's routines, and however that is, managing home life, if going back to work, if that is part of your lived experience, managing all of a sudden so many more messes. There's just the executive functioning is overwhelming at best. We also see hormonal changes impacting executive functioning and emotional regulation. And so this would be also the we know that now 90% of autistic women and very, very high percentage of ADHD have PMDD. So having those hormonal changes month after month and the deep emotional and executive functioning challenges that comes with it, and how much PMDD and PMADs are connected. Those perinatal mental health, perinatal. We all know what PMADs are, right? On this one, perinatal anxiety disorders. There we go. Mood and anxiety disorders. I promise I know what I'm talking about. And then we also have increased sensory demands and triggers. I think we all can have heard of Touchstone, right? That's probably the most sensory experience that most parents have. And when everyone's saying they're touched out, and then there are certain people though whose sensory experience is so much more intense, and it's not just being touched out, it is that one whining sound that just hits in a different way, where there's so much emotional dysregulation there, and maybe even dissociation, because I can't get away from this. I can't get away from my baby. I love my baby, and I don't love how I'm feeling right now. And that isn't really accepted within motherhood or parenthood. And so beginning to see that, wow, I'm responding to this so differently than other people, even though we're going through the same general parental experiences. And so again, is there something wrong with me? And then being able to find a community of, oh, there's just something different with me than what is modeled around. And then also new interpersonal dynamics can also increase projection sensitivity dysphoria. The biggest shock for me, and we'll go into more of this, was that all of a sudden I thought that I never had a date again because I was married and had my husband, and all of a sudden I had to date new moms. And seeing that there were just these groups of moms that had an experience that I wasn't having. And so we see that across the board, right? That there's not the same lived experience across the board, and what that can do then for the rejection sensitivity dysphoria and feeling is, again, that is there something wrong with me, and being able to slowly see there's something different. And I realized, Jane, is that something, and Jane, I realized that maybe I just jumped in because Erin pegged me, but I think it was actually you that wanted to talk on that.
It's all good. I mean, I'm happy to jump in if you'd like.
Yes. I don't know if you want to talk.
Or we can do the next one. I think that was such a lovely explanation of everything that was there. And I'm just going to give some more examples here when we were talking about when Skylar was mentioning increased executive functioning demands. And with executive functioning, we are thinking about things that require like remembering, especially with short-term memory, tracking information, like starting a task or remembering to finish a task that we're wanting to do. So when we say executive functioning, we're thinking of things that tend to be in that kind of realm. And there's a lot of things that involve tracking and remembering in this phase of life. There's more appointments, doctor's appointments for the pregnant person, doctor's appointments for the baby, and then whatever other appointments might be going on during that time period. Supplements, potentially medication as well, keeping tracks of the do's and don'ts. So of like what somebody can eat or not during pregnancy. And then, postpartum, there's all sorts of those are ideas around, or not ideas, but things to learn around kind of do's and don'ts with baby. I want to ask real quick, I don't see the slideshow. I can keep going a little bit anyway. Perfect. Okay. Yeah, so organizing care items, again, both for the birthing person and for baby. There's just a lot of extra stuff of diapers and all the things that go in, right? And we think postpartum, like, again, there may be medications. There may be, making sure there's food around. There's just a lot of care items, a lot of different ways to have around and know where they are and keep track of. Learning birthing techniques and any other sort of like information that somebody's going to be wanting to absorb. There's a lot of different elements to be kind of looking through and making decisions on that too, which can also just be a stressful process of trying to figure out what is feeling right and digging into all these different techniques and the different perspectives, making medical decisions, both for self and for the child. And those aren't always like so straightforward, right? There are various points, like for example, maybe in pregnancy where there may be a choice that a provider is bringing up around birth and what direction to go there and thinking those through. Bio-tracking. So those are all those elements, like especially kind of in the newborn period, to track around feeding of how far apart are feedings, how much has baby eaten and things like that. Diapers, sleeping of, again, in that beginning phase, like of how much sleep is the baby getting? How long are those periods of time? And you can see with all of those things, there's quite a lot of information to be tracking and things like that. And just in general, it's really shaking up maybe what has worked already for somebody to kind of get tasks done, and suddenly there's a million more. And that certainly is going to bring in some new challenges.
Could I add to that really quick, Jane? I just really quickly wanted to add that, as clinicians, you may see your perinatal clients struggling with some of these things and expressing that these are the sort of the marbles that are getting dropped. These are the things that are sort of expressions of the impact of the demands. But like Skylar said, because of the embracing of motherhood and I want to do the best for my child, I want to be the best mother, you may actually see that these things are happening, but then to be curious about, is the mother going to the bathroom before she gets out the door? Has she eaten? She's got the whole baby stuff, but is her stuff packed, right? Is she sleeping, or is she had to delay her sleep because she's still dealing with trying to take care of all the things that got messed up, and making up for I didn't pay that bill, so I need to do it, after the baby goes to bed. So notice the mother in that, or the parent in that, the birthing parent or the parent in that, it may not be the expression in those actual executive functioning tasks. There may be the masking or the ability to engage with those, but then the falling off is in other spaces, especially her own care or their own care.
And one point that just off of that is to be really asking about the internal experience, not what we're seeing on the outside of like, oh yeah, everything's getting done. But also, what is it like for that person to in all of that, not just what we see on the outside. All right. So we also want to touch on that, like, although we're talking about some of the pieces that can be difficult as an ADHDer in this time period, that being an ADHDer is so much more than just the times that things are hard, that we don't see ADHD from a model of just being a deficit, that there's so much more nuance to the experience. So we're wanting to bring in some joys that people experience as an ADHD or parent. One, bringing creativity into play and activities. Another is, I'm going to bounce to the third one and then pop back, like being able to both share, ADHDers tend to have interests that can be deep and that they really enjoy. And it can be both sharing that with their kids. And I think there can be the other side of also really enjoying and digging in. We start learning what our kids' interests are. I know I personally have had a lot of fun. Like, one of my kiddos is really into science. One of my kiddos is really into princesses. And it's really fun to get into both of those worlds. And then also a willingness to create an unmasked family culture. So there's a lot to that, but really like having a culture in the family where people are able to kind of embrace these different elements of themselves, where we celebrate these elements that may not be always celebrated, maybe when the parent was growing up or sometimes in the outside world, but building a culture within the family where those elements are celebrated and enjoyed.
Yeah. And so, we wanted to talk a little bit on a personal level about, our own experiences with ADHD identification, realizing that, we were ADHDers, and then navigating that through both like our own identification, but also getting diagnosis and what that process was like. I think because it speaks to the power that it holds to be able to either be a really incredible process, or something that can really hold people back in that process. So, I guess I'll start. When I got diagnosed when I, a year, maybe 2 years after, no, 3 years after becoming a parent. And that diagnosis actually came 2 years after my first neuropsych evaluation. I had reached out originally in postpartum because I'd always had executive functioning struggles, always just kind of held that as an example of not being smart enough. I just felt like I was just kind of like not smart and sort of ditzy and like just, I just am sort of flighty, and that's just a personal characteristic. But it was really getting to the point where I could, I was saying the wrong words for the thing. I left keys on my car and had people honking to let me know. I had an iPad that I left that, ended up in the middle of Western Avenue down the street. I got in a car accident because of inattention. So it was really starting to take a toll. And the level of masking was, and feeling not good enough was starting to impact my emotional well-being too. Anyway, this first experience, I met with a clinician who didn't seem to have a lot of questions about my experiences previous to motherhood around, executive functioning or attention, and went through the neuropsych evaluation, and the results were that I had an issue with adjusting to parenthood. That I think I reread the report recently. It said that I was probably having more anxiety than I was willing to admit to myself. And that I was holding myself in a level of perfectionism in motherhood that was leading to unresolved, unacknowledged anxiety and postpartum depression. And that if I could resolve that, and this is what the white man with the ponytail person who diagnosed me with an adjustment disorder told me, was that if I could be nicer to myself, and start to feel less anxious by not being so perfectionistic, that my executive functioning skills or issues would go away. I left that just really like, well, this is a me problem. I need to fix this. And I got in therapy and tried to focus on my anxiety and depression, but realized that was thankfully realized that was bullshit, and excuse my language, but was able to find and get a lot of beautiful community support and strength to have the courage to try again. And I had to see someone who had diagnosed someone that was very close to me, and who would diagnose someone with an understanding of different conceptualizations of ADHD. So finding that was a game changer, and it's absolutely changed my life for the better. It is the best thing that has ever happened to my mental health. So, yeah, that's my story, and I'll pass it off to the others.
I think we're thinking about Skylar going next.
And there I am. Hello. So I have a very different experience than the other two, because I received a formal diagnosis when I was 19. After my first year of university, I saw the people I was around, and we were, of course, all struggling with university life. But what I was going through was very clearly different from those around me. And so when I received my diagnosis, it was very much of like, this is what's wrong with you. Here's medication to fix you. Take that and you will be okay. Almost like my potential was locked behind my ADHD, and it was something separate from me. And so I just took that as what was going on. I didn't question it. And I went on. My body didn't tolerate stimulants well. So I instead invested a lot of my emotional and physical energy into masking my ADHD very poorly. But I was able to get by. I was able to advance in my career. I was able to hold on to hobbies, friendships, and, you know, everything was by the skin of my teeth, always got to work late, all of that fun things. But, you know, notes were always a struggle, but I figured it out. And then once I had my first child, everything that I had figured out stopped being manageable. Everything got really overwhelming. And as a mental health professional, as somebody who already knew I was ADHD, I really didn't have the understanding of what it meant to be an ADHD parent, right? I didn't understand the hormonal shifts. I'd never really identified in my first pregnancy and postpartum with postpartum anxiety and depression, because it did feel different. It was really real. It was hard. I ended up taking an extended leave, but I wasn't depressed. I wasn't anxious. I was just something else. And it was something that it's not until now that I recognize I wasn't prepared for being an ADHD or parent, because I didn't know that I was an ADHD, or I thought I had ADHD. And it wasn't until I started really diving into the neurodiversity-affirming movement that I was able to shift. And I was able to go from somebody with ADHD to saying, oh, this impacts who I am. This impacts the way that I engage with those around me. This impacts the way that I am, the benchmarks of who I am as a parent. I'm not going to be a Pinterest mom. I'm not going to be able to do all these things, because that's not that there's some ADHDers who are amazing Pinterest moms. I'm not that. And also I am these other things that other people aren't. I'm a really well-researched mom. I am an engaged mom with these things. I'm a really great advocate in ways that I think are very much, again, that ADHD joy part. I know so much about my kids. I know I can explain so much about who they are and have that and connect with them. And as I was able to shift from someone with ADHD to an ADHDer within my parenting identity, I also got to shift from a not good enough parent to a full and aligned parent. I'm obviously, you know, there's always, no one's perfect and we're not supposed to be, but being able to show up in my good enoughness every single day is something that I know without the neurodiversity affirming paradigm and really being able to understand that, I would have never gotten here. And I would have never gotten here just with an ADHD diagnosis. And I think that's the really big thing, is because when I was with therapists who didn't understand neurodivergent affirming care either, it was always mask harder, try harder, get more skills, and not you're good enough, let's find the supports you need. And that, I think, is so important for clinicians to be able to recognize as well. And why we're doing this work now in this presentation is just to start to fundamentally shift the way that we view what it means to be an ADHDer. So that's my part of it. And I think now, Jane, you wanted to speak to your experience.
Yeah, perfect. So, I mean, the great thing is we're getting to hear 3 different experiences today. So mine is also a little different than both Erin's and Skylar's. So for me, it was definitely late realizing around ADHD, and it was after having both of my kids. And for me, initially, it came, by the way, in a pretty roundabout way, that it was more of, for me, there's something I had learned 10 years before all of that around how my eyes work, that my eyes don't always work together in the way that other people's do, which can lead to like headaches and being tired when I read. And I had known about that for a while, but then I had learned that that is a really, really common thing for ADHDers. And that really caught my attention. I started researching, I started doing a little deep diving, and I'm like, there's a whole lot of parts of myself that both people around me and myself, like, I thought about more as quirks, like, oh, that's just the way, I am, like, and I think for a lot of reasons, like, nobody had really nobody had brought up to me ADHD being a possibility, and it hadn't really been something that I had thought about. And up to that point, I had seen, a fair amount of different therapists for different things. It wasn't something that had ever come up. But once I started reading about it, it was like, I think this could be a thing for me. And I got really lucky in my experience once I started talking to people about it. Then my first thing I did was bring it up to the therapist I was seeing at the time. And was like, hey, I've been reading about this. I think this could be a possibility. Here's the reasons why. What do you think? And her answer was really helpful and what I needed then. She heard it and she was just like, yeah, I mean, that sounds right. That could definitely, be the case. We can talk about it, or you should look into that more. It was things like that. She definitely didn't give a definitive, like, yes, I've been thinking about this and was waiting for the moment to bring it up or anything like that. But I also didn't need that. I kind of needed somebody to be open to hearing about it and not shutting it down. So from there, I went and saw a nurse practitioner, got an assessment there, and got very lucky that I also had a really helpful response to it all, that I was taken very seriously. That it wasn't discounted because I went to graduate school and I'm able to work and these different things. That she really heard me. She took my experiences seriously and kind of ran from there. And with that, for a combination of different things, like realized pretty quickly that, yeah, like this is definitely me. Like I am an ADHDer. And I was lucky that as I was doing my deep diving, learning more about it, that I fell into research that was pretty affirming. So it was I got very lucky that my experience in all of that was really very positive. I do want to point out though that if it had gone another way, if the therapist that I was seeing, if that nurse practitioner had just shut that down, it's like, no, that doesn't sound right. Like somebody would have noticed by now, or things that people are being told pretty frequently. I'm not sure if I would have kept going, at least at that point. I think there's a good possibility I would have felt embarrassed or felt like, oh, like I must just be projecting something. And at least I would have put it to the side for the moment. And that would have been such a bummer because understanding this identity and getting diagnosed for me has been, I think Erin said something similar, but has been like one of the most impactful things for me, my identity, my mental health that has happened in my life. And imagining like if I had felt shut down and not kept going with that, it's really hard to even kind of think about what those years afterwards would look like. It'd be incredibly different. There's all sorts of elements of like knowing myself that have been incredibly helpful, and being able to connect in with neurodivergent communities has been incredibly powerful and helpful for me. And the last thing that I want to mention, that like these last couple of years have been a really good experience. I've been very lucky there. I do want to mention, I'm not going to go into detail about it right now, but there has been very real impacts though of not knowing this about myself and not others knowing this about me up until adulthood. There are things that were very hard at various points in my life that having this information would have made it a lot less hard. So I'm very lucky and grateful that the last couple of years I've had such good experiences, but there has been impacts of the late recognition there. All right, so I think we can move on to the next part.
Hello.
Hello.
So I think now we just wanted to spend a little bit of time discussing this and kind of the impacts that this has. Sorry, now the new thing, I have to back up. But how we see it with our clients and in our therapy rooms, because one of the things that I'm sure Jane and Erin, you have as well, is people coming to us after not having an affirming experience or working with therapists. I know that I had a discussion recently, and it was a really great one, on a therapist Facebook group about what ADHD really does look like in the perinatal period, because being a parent in 2024 is hard for everyone. No one's saying that it's not hard for everyone. And I think that, like what happened to you, Erin, that because it's hard for everyone, that then that somehow is then used as then it's not any harder for you. You're just not handling it like other people can handle it, and the deep harm that that can cause. And so as practitioners, how do we better understand ADHD and its presentations for ourselves? And then how can we approach our clients in an affirming way so that we're not shutting them down? We're not essentially gaslighting them into saying, you just have to try harder and do better, when we're doing great and we're struggling. And those two things can live simultaneously. And so with that, I'm wondering, just for both of you, how that looks with it, like what practices have you had within your with your clients that have been really affirming?
Yeah, well, I think, I mean, Jane, I loved your example of what felt affirming with disclosing to your therapist, and I think it all kind of starts there, especially as we talk about perinatal clients who are starting to be curious about that and trying to figure out how to name what's going on in their lived experience. What is that gap? Like, why can't I just do the thing that everybody seems to be able to do? Why can't I hold the things that everybody seems to be able to hold? And so, bringing that curiosity and sort of walking beside them in that experience of starting to look at their lived experience, their identity, is I think the first step. And, I think as I certainly, in going through my own process, I think I'm privileged in coming to this with such a sense of knowing what ADHD can look like, of really seeing it as this positive thing. I think that we've been told as a society a lot of messages that can, show up if that isn't your background, that can cause those moments to feel like there's tension or confusion or feeling not sure how to handle it. I think one of the things that I've noticed, and just doing a lot of consultation and trying to support clinicians around this, is the sense that this sort of idea that around disqualification in diagnosis. So a lot of times there's a conversation like, well, is it trauma, or is it birth trauma, or is it ADHD? Is it anxiety and depression, or is it ADHD? So this idea that, if one, it has to be one or the other, and really not seeing the ways in which so many of the anxiety and the depression and the trauma symptoms even can be a response to undiagnosed, unacknowledged, or unidentified, unaffirmed ADHD profile, or it can be a co-occurring thing that's just with a sensitive nervous system, right? You're going to notice that there's higher rates, and a sensitive nervous system, more sensitive hormonal system, right? That sensitivity really exists in all the different systems. And so it makes sense that, you're going to see more PCOS. You're going to see more EDS, like health, fibromyalgia, autoimmune, right? So, these are all actually signs. These are actually sometimes confirmations that are not confirmations, but supports to an overall clinical conceptualization that supports ADHD as a diagnosis, not something that disqualifies it and says, well, if it's this, then it can't be ADHD. So that framework has felt really important.
And I think, like, for me, kind of, at least to me, this feels like it's bouncing off some of those ideas. Like that, like one thing that I've loved around embracing neurodivergent affirming philosophies and how I work is that for me, I know, like, before I felt a lot of pressure that, like, say I was going to be the one bringing up, like, hey, is ADHD an identity you've thought about before? I felt a need to like know, like to come in from this expert stance and tell them, like, I'm seeing all these things, like I'm pretty sure that this is happening, like that I needed to be sure. And at this point, I enter it as a conversation of like, hey, like there's some elements I see that are similarities that, you know, ADHDers experience. Is this something you're interested in exploring? Is this something you've thought about? Which just starts the conversation very differently. Because one, it brings less hesitation, and that like if they don't resonate with that, that's fine. Like it was still like an important thing to bring up if I was thinking it was a possibility, because it's equally good information to know whether that identity fits or not. I don't have to be right. And I don't have to come in from like above, like knowing. And I think it leads to these great open conversations and exploration, and leads to less hesitation for me of like, well, am I right? Like, can I bring this up now? Like, what if I'm not seeing it from the right way? Because that's fine. We're in it together. And I don't have to be, having it be a collaborative conversation feels so much better anyway.
Yeah. Well, and I think that non-hierarchical approach is so important, because especially now with TikTok and Reels and this, that, and the other, I also have so much more. I have clients who understand the lived experience of ADHD and not just the stigma of it. Because 5 years ago, I mean, granted, I wasn't approaching it from the neurodiversity-affirming stance that I now have, but when I would bring it up, it was basically like the way that clients understood that was you're shameful and annoying, right? Because that is the medical model, when the entire pathology of ADHD is how it negatively impacts others, much more so than how it feels within the sense of self. And so now I have so many clients coming to me and saying, hey, I was watching these TikToks from ADHD moms, and I'm recognizing so much of myself in this experience. And I'm so excited for that, because we know ourselves. We know what resonates and what doesn't. I know, other clients who none of that resonates because it doesn't apply. And this idea, though, that we have to give a top down, like this hierarchical diagnosis, instead of approaching through identity development and being able to go, oh, you have this whole just different way of existing in the world, and you have community around you at the same time, I think makes the entire process so much more affirming and gentle and kind. And so when I see, is this just a trend? Is this just people jumping onto something? It really does break my heart, because I think all three of us agree that having a positive neurodivergent identity has really become the anchor point of our lives.
Yeah.
And we see that within our clients too. And social media and this dissemination of the lived experience is core to that.
Yeah. And I think that's what's threatening, to be honest with you. I think that's radical. And I think that some of the emotion that shows up, especially when we talk about ADHD identification, and this is my own personal take, my hot take. But,
Love the hot take.
I think that, there's ableism that's embedded in the idea of the transition, and that the idea of becoming a mother, especially, that is really challenged and uprooted by the idea of supporting people in ADHD identification, because we're both supposed to, we've got this normalization of, motherhood as suffering and sacrifice and pain and discomfort, right? And yet if you're not handling and sort of managing your discomfort and your pain and your suffering, then somehow you're not like doing motherhood well enough, right? So to be able to acknowledge that something is going on, that's, that you need extra support, that you need to have it validated, that it's so, that, and that you get attention for, and a name to something that may, I think it elicits this sense of like, wait, but you don't get to get that. You don't get to like, that's not, I think it's a triggering thing in a deep visceral level in terms of the ways in which we hold this this myth of the mother, and the ADHD mother that's supported and affirmed brings up things. And I say that only because that's something that I've tried to kind of examine within myself, as like, what has shown up in earlier stages in this process. So I'm not speaking for everyone, and I'm not speaking for your experience with this, but I really think that what we're talking about, it's powerful, and that the hope is that it's part of other diagnoses and other identities and neurotype identities and nervous system identities that are going to continue to do that work of challenging these ableist structures around the mother that are detrimental to both neurodivergent and neurotypical mothers and parents. So
it's going to, patriarchy harms us all, and so does ableism. And I think especially within this, because every single parent, regardless of neurotype, deserves support. And if we're able to really identify what the support needs are for each individual person and meet that from a place of abundance, then there also isn't the need for gatekeeping and, I have to do this on my own, so then you do too, and you have to, right, you're not doing it right. And instead coming back to a communal, and I think that's obviously so much more than what we can do in the therapy room. And we can also name through a social justice stance that this is missing, that it is an external support that is missing and not an internal trait or skill that should be attained. And being able to really switch that, I think, is, if anything else, the most revolutionary thing we can do with our clients.
Thank you so much, all of you, for your just not only your knowledge, but your understanding of how delicate the situation is and people's different stages of awareness in this for themselves, sometimes for their children. So what we're going to do to make sure that people who have seen this amazing Tuesday Tea have access to is we're going to link to our consultation page and assure that everyone can follow up. So that's going to be at the Touchstone website, but we'll also link it to this training. So to this tea. So I appreciate all of you for taking the time out of your day to share your knowledge, your lived experience, and just your professional experience with us. We really appreciate that.
We hope to see some of you all in July as well for our training on neurodiversity-affirming care through the Touchstone Institute as well.
Oh, that's the lead. Okay, but so there is this amazing training for people who want to follow up. So please give us a bit of like what that's going to look like, when that's happening, and how people can reach out for that. I will share a link to that, but what types of people who you expect at your training, what level of practitioner, who will best benefit from this?
Well, this is going to be a sort of foundational training around going through the pillars, the foundations of neuroaffirming care, neurodiversity-affirming care, and then being able to take those philosophies and start to think about the lens in which you could bring that to your own practice. And so this is not going to be a list of here's, do and do these things, and then you're going to be neuroaffirming. This is, let's take these principles and then let's create some confidence that you can flexibly think about how you would respond in certain, situations or with certain client concerns or presentations. So it'll be a little bit of both, and hopefully clinicians will leave with a sense that they have in their mind a map of what they want to start integrating into their practice. And then we're going to be hopefully following up with more, specific, more advanced, presentations. But this is really for anybody who wants to learn more, knows a bit or knows none or knows a lot, but they just want to kind of dig back in and deep dive into those themes of neuroaffirming care.
Yeah, and the training's going to be 4 hours. It's on July 12th. So if you're able to take some time on that Friday in the summer to learn, it's going to be great, again, as Erin said, for folks who are newer to this philosophy, but also folks who have been learning to deepen what they've already been learning.
I love all of that. And I also feel like perhaps for people who cannot attend the live, that this will at some point be a self-paced training.
Yes. Yes, that's
Okay. Excellent. Right. So good things happening in coming events.
yes.
And thank you so much for letting us, join you today and continue to.
Sure. Our
Thank
pleasure.
you.
Sure. Thank you so much, everyone. We'll make sure to add those links. And we're looking forward to all of the upcoming happenings.
All right. Thank